Britain's coronavirus lockdown could be extended by weeks. Current measures only allow people to go outside for essential purposes like work, grocery shopping and for exercise. Some ministers suggest the lockdown must remain in force, especially with the long Easter weekend about to begin. The UK has reported more than 7,000 deaths and 60,000 infections. Medical experts are not expecting the peak to come for more than a week.
British Prime Minister Boris Johnson, who caught the virus, is in stable and improving condition, although he remains in intensive care. But still, not a word or tweet from the UK leader himself. From mild symptoms to the ICU, let's take a look at Boris Johnson's battle with COVID-19. Now, it all started on the 27th of March, when Mr. Johnson confirmed he had the coronavirus. He's the first world leader to be infected with COVID-19. He posted a video message on Twitter saying he had mild symptoms and a fever. He said he was self-isolating in his Downing Street apartment and would continue to lead the government. And he did just that. A few days later, Mr. Johnson tweeted a picture of the first ever cabinet meeting conducted online. He also continued to chair the daily coronavirus response meeting. But things took a turn on the 3rd of April. Mr. Johnson was unable to shake off his symptoms after 7 days of self-isolation. That means he had to stay in quarantine. Eventually, he was admitted into hospital for precautionary tests, sparking concerns over his health. Downing Street called it a precautionary step as he had persistent symptoms for 10 days. The next day started with another tweet from Mr. Johnson. The Prime Minister said he was in good spirits, even though he was still experiencing symptoms like cough and fever. Less than 12 hours later, things took a turn. Downing Street saying the UK leader's condition worsened and he was moved to the intensive care unit. He received oxygen treatment but did not require a ventilator. But more importantly, Mr. Johnson had asked the Foreign Secretary, Dominic Raab, to deputise him where necessary. Now, Ollie Barrett joins us live on London for more developments from the UK. Ollie, what can we expect from the lockdown review? Any prospects of restrictions being lifted?
I think that's very unlikely indeed. We are also unlikely to get out of the meeting which is taking place a little bit later on today, a final decision or a firm decision about what's going to happen from Monday onwards. But it's looking increasingly unlikely that those lockdown restrictions, which were due to be reviewed after 3 weeks, that 3-week period comes to an end on Monday. It's increasingly unlikely that the restriction is going to be lifted, the lockdown is going to be eased in any meaningful way at that point. What we will therefore look out for is a sense from the government perhaps of how long they might feel that they need to extend the lockdown restrictions for. We've already heard from Wales, the government in that part of the country, saying that there's no way that the lockdown is going to be lifted on Monday there. We've had a similar guidance from the Scottish government as well, so I think we will soon start to hear those noises from London. Part of the reason we haven't had huge amounts of clarity on easing of the lockdown from the London government is that what they don't want to do is distract from the main aim for the public at the moment, which is to stay at home, to not go out, to stay under those very strict lockdown rules. They don't want to distract from that at a crucial period for the outbreak here.
Ollie, results. Are we seeing any positive impact on infection figures so far?
We are starting to see what the experts call green shoots. Still too early to get a true sense of whether the curve is going to flatten in a meaningful way in the coming days, but officials do say they believe that we're heading in that direction and that we're starting to see some of the effects of the lockdown restrictions that are in place. Hospital admissions, the number of confirmed cases as well, are not accelerating as quickly as they might have been expected to do, particularly if there weren't those social distancing, safe distancing guidelines in place. So even though the numbers of deaths on a daily basis continue to rise, there are reasons for optimism in terms of the overall curve.
Ollie, long weekend is coming up. What are authorities doing to convince people the importance of staying at home over the Easter weekend?
Well, politicians are out in force on the airwaves trying to ram that message home. Stay where you are. Don't go to your second home or to visit family or take a long drive to the countryside for some kind of barbecue or walk or picnic. Take your exercise close to home once a day. Stay away from other people. As I say, the politicians are trying to ram that home in their media appearances, and we will hear that message in the press briefing later on at Downing Street too. We're also seeing a public advertising campaign to try and encourage people to follow the guidelines. And the police as well are also saying that they will enforce the measures if they are required to do so. And we've heard from police forces today that over the last weekend and the days that have followed, they've had to break up several house parties. They're saying they really don't want to have to do that this weekend.
Thanks very much for that. Ollie Barrett speaking to us from London.